Today's topic is going to be health assessment for hormone replacement therapy. Probably would be the more suited one, or uh, tailored health assessment across the board and genders. Do you want to open up and talk about fundamentals of hormone replacement therapy? What it is, what's the purpose, common uses, most common hormones used that we see, and maybe there are something that you would perceive as a better choice of the tool for the job at hand.
Yeah. So if you've been following any of our videos, most can kind of get a grasp from our previous videos that hormones are a signal that environment is proper for reproduction. So fertility of your internal environment and external environment are conducive for passing on to the next generation. So having said that, the hormones, every hormone comes from cholesterol molecule and how that interacts with the environment, aka sunlight or cold, right? So that's just a quick overview of any type of hormone replacement from the sex hormone side. So with females, the ones that you're going to commonly see is progesterone, estrogen, as far as prescription grade, right? And then the other common ones are going to be thyroid related, whether that's T4 or T3. And then every now and then doctors will try to get fancy and use something like Clomid or other selective estrogen receptor modulators or serums. And the reason they're doing that is they're just trying to coax the pituitary gland to send LH and FSH to produce the sex hormones. Now, most of the time, you don't have to do any of that if the lifestyle is really poor. In other words, what I'm saying is if your lifestyle is really poor, that's the first thing I try to correct before jumping to full-on medical prescription drugs. Because like all drugs, they work, right? They do exactly what they're supposed to do, which also means it's going to change everything. And you only really want to do that if you absolutely need to. So first thing is you can start with lower tier precursors or supplements, right? They're classified as supplements because they're not a sex hormone yet, like pregnenolone or DHEA, right? Those are not technically sex hormones yet, but they can easily be converted by your body into that. And so I like to start there and then combining that with proper lifestyle changes to coax the body into doing the right thing with those hormones. Now, before you even do any of that, you want to have some level of, are you biologically ready to do that? And what I mean by that is, for example, if your hormones are tanked, especially if it's a combination of thyroid and sex hormones, and we're still talking about females, and you raise those, whether that's through a supplement or through a medication, you could potentially exaggerate something like anxiety or something like sleeplessness or any one of these things, because those, especially thyroid, influences wakefulness and your ability to be kind of stimulated in a sympathetic way, right? So most people would interpret that as some level of anxiety. That has to do with potentially not being prepared to handle the correction of your hormones are way down here. We're going to bring them up to normal. There could be some of that. So just being forthright with patients of like, hey, this is a possibility. There's a way kind of around it, but it's much slower, and that's just letting nature and just the lifestyle changes do that. And some people are okay with that, right? Some people just cannot deal with extra anxiety. And so in the moment you start correcting, especially thyroid hormones, they'll experience some of that. That is a real effect, and most doctors don't tell you about that. So right off the bat, when you go to a doctor, they aren't always forthright with the potential side effects, right? They just kind of skip to, hey, if you take this, it will make that better, right? But there's stuff that happens in there, right? And some of that stuff may be stuff that you're not prepared to handle. Now, on a more serious note, let's talk about some men, right? When a man, especially if he's a little bit older, goes to like a clinic or something like that to get hormone replacement therapy, they're hoping that they're the expert and that they do a proper risk assessment on them. I find that not to be true. I don't find that very many clinics, if any, I have yet to see any, does a proper risk assessment of your cardiovascular health in terms of, are you actually going to benefit from the testosterone replacement therapy, or are you actually going to gain a risk factor? And what I mean by that is, I've had the experience of coming in after somebody has been prescribed testosterone replacement therapy for a short period of time, like 4 months, and that resulted in a stroke for that person. The reason why is because when he went to the clinic, and he thought he was going to be, he thought he was going to the experts, right? They basically just ran his sex hormones, that's it, just sex hormones, and saw that they were low and gave him a prescription. He later got a full blood work, and hematocrit was high, hemoglobin was high already, right? But like, this was only like a month after he started taking the prescription medication, and he had risk factors that told me, hey, at this exact moment in time, it's probably not a good idea to start with the testosterone replacement therapy. It's going to put you at risk. I saw that blood work way too late. His stroke had already happened, but he showed me that blood work after the fact, and I said, did the people prescribing you this medication do this blood work? And he's like, no, I did that myself. I'm like, so what did they do? And he showed me what they did, and it was just his sex hormones. That is negligence. That is flat out negligence on that company's behalf. I don't know the company, or I would say it out loud, because that is, you're taking people's hands in your wrist. Like, hormones are powerful, very powerful. And if you have exaggerated risk factors already, maybe you shouldn't be taking them, right? And it doesn't mean you can't take them, right? The guy had low testosterone. He legitimately could have used that help, but he had other factors that you need to take into account for. One of the big ones, especially in this term, is thickness of blood, right? Like, that's where hematocrit comes in, hemoglobin, red blood cell count. If those are already skewed up, I don't care that your testosterone is low. We need to fix those first, right? And that goes back to our video on the basics, right? Like, let's get some cardiovascular work going. Let's get you outside. Let's get you moving around. Let's make sure that you're oxygenating tissues well, and let's try to get this hematocrit and hemoglobin taken care of, right? So those are simple physical things you can do. Other things from a dietary perspective, especially for the hematocrit, is proper hydration, right? If you're not hydrated properly, you're going to have thicker blood to begin with. So let's start doing that. It's basically kind of like preparing to be able to take the testosterone, and that might only be like 6 weeks of that, right? Follow up with some blood work, and you're like, oh, these numbers look much better. Okay, you're not at risk for this, for a stroke or a heart attack or a cardiovascular event. Now we can talk about some prescription testosterone for you, right? And then
Basically, what
another,
you describe now
go
is
ahead.
the importance of an interview, which we always highlight. Like, okay, if we're going to run your blood test, we need to sit and talk to you to understand what the blood test shows. Even if it shows normal readings, we need to understand how you got there, so you stick with that. And it's interesting that you just highlighted as well, like, hematocrit and all these kind of things. Something that I've always done for my cardio would be Stairmaster, and I have done it. I have documented on my Instagram since Instagram came out, like over 10 years, and people used to say, "Oh, you're gonna lose your legs, this and that." I'm like, dude, I have one of the biggest legs you'll ever see anyway. Shut the hell up. And yesterday, I actually trained with somebody who was like an IBB throw and over 300 pounds, dude, religiously does cardio now all the time because of that,
Yeah,
because we have been around each other for years and we have spoken about it. And he was like, how do you deal with high hematocrit? Why do you never have issues with it? I'm like, because I always try to stay fit. So we started to do that. And because of that, he's growing quicker. And
yeah,
I'm like,
because you're oxygenating tissues better, right? Like, at the end of the day, it comes back to the basics videos that we've done on mitochondria and keeping them healthy. If you're oxygenating tissues better, you're treating your mitochondria better. If you're treating
and
your
what people
mitochondria better,
miss out is that cardiovascular training is nowhere near as calorie demanding as they think it is. It's
no,
just,
not exactly. But there's a difference between cardiovascular performance and cardiovascular training, right? Cardiovascular performance is very demanding. Cardiovascular training, gaining the effect, totally not that draining, totally doable for everybody. The problem is, it has to become like brushing your teeth, right? It has to be
yeah,
something that
you
you can,
lose it very fast.
You lose it very fast, but it doesn't 20 minutes, right? Like I do the same thing. I do cardio every single day, 20 minutes, right? 20 minutes every morning, knock it out, move on with my day. I don't have to worry about my cardiovascular fitness. I don't have to worry about my hematocrit. I don't have to worry about whether I'm not transporting oxygen well to all tissues. But at the end of the day, that's not a proper risk assessment from, especially when you're going to potentially take a drug that literally makes those values go up, right? Like that's what I highlighted to this client of mine was, hey, the reason why this happened is you were on the edge of this was already going to be a slight problem for you, and then you introduced a drug that literally makes those values go up. You literally made your blood even thicker than it already was in the course of 2 or 3 months.
So can you
And that
expand maybe on health assessment protocols, and are they gender specifics that you would prescribe to
Yeah,
male
yeah,
women?
yeah. So absolutely. So right off the bat, male or female, blood thickness. So that's going to be your red blood cells, your hemoglobin, your hematocrit. That is definitely something across the board, male or female. You want to check those. You want to make sure those are not on the high end before you start taking any kind of hormone replacement therapy, especially if they're sex hormones.
And how would you improve that?
Through exactly what we just said, right? So getting enough cardiovascular work and hydration for a given amount of time, right? Like if you get an initial blood work and it's like, hey, you have some risk factor here, about 6 weeks of consistency with some good cardio and good hydration. You could check it again. If the values are going down, that tells me that you have enough input that you should be fine. You should be able to continue to have that level of input, and the values should come back down into the normal range, and you could start testosterone or sex hormone replacement therapy.
Yeah.
Other hormones, right? Like, for example, I talked a little bit about with females how they're predisposed to anxiety if they're going to get thyroid hormones fixed. So again, if the person, the female in this case, already has a predisposition to psychological disorders, right? Like depression, things of that nature. This could make, or just feeling overwhelming stress. It might be a bad time of the year for this person, right? Like, she's overwhelmed with school or whatever, right? Then at that point in time, I would actually talk to her. Hey, right now at this very moment, we could try some thyroid augmentation supplements / medications if that's what you want to do. But I will warn you, it could bring up anxiety. Is that something that you're willing to deal with at this time? Right now, could we reduce that anxiety that gets introduced? Yeah, if it's the right time of year, simply being outside reduces anxiety. That's been proven over lots of studies, right? Removing electronics, getting some grounding, and being outside will lower anxiety anecdotally for up to 3 hours later. And coincidentally, now that more and more people are kind of knowing this information, I've actually in a group where a molecular biologist, she tests her blood after all of these events that she does, and she's literally shown a blood test of 30 minutes of outside grounded with sunlight, zero blood clumping, and doing it again the next day without going outside. The same break, right? This is for a lunch break. She takes her lunch break inside, takes a finger prick, goes underneath the microscope. Lots of blood clumping. So in other words, blood flow is low, oxygenation is low, right? She goes outside for 30 minutes on a different day, on a different week. Blood is completely different. It's nice and dispersed. It's flowing correctly. She's like, this is literally just 30 minutes of grounding and sunlight exposure. So that reduces anxiety plus improves blood flow. And we have also more direct studies showing that same stuff. So if it's
And
the
we
right time,
also have some anecdotal things as well, like on our group where people start doing this stuff, like just walking outside after a meal, and they report after a week, like, feels like completely new body. And only thing
yeah,
that changed, go outside.
yeah, yeah, absolutely. So if it's the right time of the year, right, you could start with handling some of the anxiety for a female that's going to be bringing up her thyroid hormones. But again, that's a discussion of, just like you said, it's an interview type discussion of, hey, if we bring this up, this is a possibility. Are you willing to deal with that? And if you are, it's going to be short lived, right? Because once they get up into the right range, you don't have to continue to take the medication. You just keep it out there for a certain amount of time and make sure that if this was wintertime, you would be taking it for a little bit longer. But if it's springtime, you're only going to be taking it until the sun gets really strong, and then the body should be able to take over. And my goal always, right, with any hormone replacement therapy, if you're of the age where you should be able to make these yourself, we can use them to get you to the right place. But then we also do an assessment of, do you need them permanently, right? Like that's a thing that doctors actually don't do. They never try to give you a medication with the purpose of getting you back off that medication. I attempt to do that with everybody that is not, 50 and older, right? If you're 50 and older and you're doing some hormone replacement therapy, you're probably going to be taking it pretty much for the rest of your life at that point, right? But if you're 34, 37, even 42,
Mm.
the likelihood that you need it forever may not be true, right? That's a misconception. That's actually something I wanted to talk about. Depending on your age, hormone replacement therapy could be a stepping stool to get you on the right track, and you may not need it forever, right? Or you may have an environment that doesn't let you make them, and then you do need them for an extended period of time until that changes, right? So
And we see kind of a little bit of backward approach where people start taking hormone replacement therapy and then, hey, maybe add this, maybe add some anti-estrogens, maybe add some CJC, and then it goes on and on and on. It's tragic. What I see in the US is like, it's just a chemist lab, like experimental
yeah, yeah. Yeah.
treatments,
So
and they just
actually,
throw
let's open that up a little bit. Yeah, because I have seen that a little bit as well, where you go in and they test your sex hormones and they do a proper assessment. They're like, oh yeah, you don't really have any risks or anything like that, and they see that you're a man and your sex hormones are low, right? So they prescribe you some testosterone, but in that testosterone, they also have an astrozole, which is an anti-estrogen that's also embedded in there, and or possibly even Clomid as well, right? Like, so there's like three things that they prescribe you right off the bat. And my question immediately when I run into people that are taking that, I'm like, did they explain to you what these other things do other than the testosterone? They're like, no, not really. They just told me that it's a combination and it just goes together. And then then it becomes my job to explain to them, hey, you probably are okay taking the testosterone. You probably needed that, but the estrogen suppressor, you didn't need that at all, because in men, estrogen comes from testosterone. So if you get testosterone that's low on your blood work, right? So it's flagged low, your estrogen is going to be flagged low. I'm like, so then they give you testosterone and then they give you something else to stop the estrogen going up. And if you, people have listened to our previous episode from this, that literally makes their sex drive low because there's no estrogen anymore, even though they're taking testosterone. That's actually the number one complaint when I see that particular setup from men is like, hey, I've been taking testosterone for like 6 months, but my sex drive hasn't improved. In fact, if I feel like it's gotten worse. And then I ask them, well, are you taking an anti-estrogen? And they're like, I don't know. And then I see their prescription. I'm like, oh yeah, there's an astrozole in there. And then they're like, that's the anti-estrogen. I'm like, yeah, you shouldn't be taking that because that's not allowing your estrogen to come up and drive sex hormone function for men, right? This is for men. In women, I often see the prescription of progesterone, estrogen, and then no testosterone. And then they wonder why their sex hormones aren't, or their sex drive is not coming up. And I'm like, well, it's because you have zero testosterone. I'm like, you have a bunch of progesterone and a bunch of estrogen, no testosterone coming on board. And in females, testosterone comes from DHEA. And then we go look at their DHEA, and it's almost at the bottom of the range, and and it's been there for a long time because I can see because their cortisol is also at the bottom of the range. And DHEA in females gets split to go to cortisol for stress handling capability or for testosterone to handle fertility and sex drive, right? So in other words, if the female is low stress and in a good environment, her DHEA goes to testosterone, drives sex drive because she's going to be fertile. But if her environment is conducive to stress and she's always stressed, then the DHEA does not go to testosterone, it goes to cortisol, right? And so they fundamentally are giving her the wrong hormones, right? They're like, oh, here's some progesterone and here's some estrogen, but it doesn't fix the thing that she went in there for, which was energy and sex drive and the will to want to move and everything. I'm like, yeah, that comes from testosterone in females, and they've given you the wrong thing, right? And it's just, I want to say negligence on doctors of not completely understanding how sex hormones actually work. even endocrinologists don't really get this right very often, right? And
More
the
often
reason
than not, I see they start with Clomid to increase male testosterone, and I'm like, you just make no sense at all because you checked your testosterone, your estrogen, your maybe prolactin at the best, nothing else, and you're just running with it. Which I would like to see. Is your vitamin D even in check?
correct, right? Again,
What
that's a
will-
basic, right? Because if your vitamin D isn't in check, then that means your pregnenolone is probably not in check and your DHEA is not in check. And those are the ones that are going to turn into your sex hormones, right? And that's the thing is they're kind of just jumping over $100 bills, which are the simple stuff to fix, and giving you these prescriptions that you can't and shouldn't be taking forever, especially Clomid. Like I can get behind Clomid for like a fertility protocol or just to see if the person can actually make their own sex hormones, right? But it cannot and should not be used permanently. And I've literally seen a couple guys come to me prescribed Clomid, and they basically got told to take it forever. I'm like, yeah, you don't want to do that. There's a lot of risk with that, right? Like that's a potential not good thing for lots of reasons because you're running the pituitary too hard with that. And I'm like, if you take it long term, you probably won't be able to make your own sex hormones very much longer. Right? You want to correct these either naturally if you're going to go that route, because that's kind of what Clomid is doing. It's turning on the natural pathway to make the sex hormones like if you were younger. But the problem is the way it does it cannot be sustained permanently. So if you
And I
want to
often
correct
see it in
it,
guys who are like in their mid 50s, and you're like, dude,
yeah,
probably
exactly. And
looking at like
at that point,
progesterone.
there's no point in stressing out the pituitary that much, right? Like at that point, it's like, okay, well, you can clearly make your own sex hormones. You're taking Clomid, great, but you can't take it long term, and you're already an aging person. You might as well go to replacement therapy and make it much simpler on yourself. Um, and I would go with some, bioidentical testosterone for a man, and potentially, if they cannot convert testosterone to estrogen very well, some supplements that help convert that, or even a medication of exogenous estrogen. That's very rare. That's very rare. It's almost always as simple as let's support some pregnenolone so we can have enough of your other mechanisms going on for men and testosterone. For females, it's almost always be able to be corrected with just some supplements, a little bit of pregnenolone, a little bit of DHEA, and possibly a little bit of 7-ketone DHEA to make more testosterone, especially if they have the ability to change their lifestyle. And it doesn't work for everybody, but in 2 or 3 months, we will know, and then we can jump up to actual medications. A doctor will literally give you a medication and tell you to come back in 6 months. I'm like, why do that, right? Like, because if, especially in females, you cannot just give them a milligrams to take and expect it to work. I have never come across being able to give a female just one dosage and it works for 90% of them. There's too many variables because of how female physiology with their sex hormones works. If I give this female 100 milligrams of progesterone and this other female the same 100 milligrams, they're going to be wildly different on the results. You cannot just set it and forget it and come back in 6 months. For females, when you start moving to actual hormone replacement therapy, actual medications, my suggestion is at least for the first 3 to 4 months, you test every 5 weeks because
Right.
they will have radically different results. So when you get into actual hormone replacement therapy for females, it does. I would highly suggest somebody who's willing to coach you or prescribe you the tests very frequently as every 5 weeks to ensure that you're taking the right dosages because it will change drastically, especially if you're messing with testosterone. I've seen too many females go in, get a prescription, they get pellets put into them, and then the pellets are permanent. You can't take those back out. The pellets are permanent for 6 months, and then they come to me and they're like, "Man, I'm having all these really weird side effects." We look at their testosterone and it's like 200 when it should be like 70 or 80. And I'm like, "Yeah, you got a lot of testosterone going on." They're like, "What do I do about it?" I'm like, "Nothing. You can't because you took pellets." I'm like, and she's like, "Well, what should I have done?" I'm like, "You should have started with the injection and you should have followed up every 5 weeks to ensure that you have the right dose." and
Right.
start low, right? Don't start high, start low so that you can always add a little bit if you have to. Because if you have to take it away, there's a half-life, right? There's a half-life that you got to wait. The pellets are no different, right? But they're even longer. So I've seen some females really get messed up. Like, don't get me wrong, pellets are convenient once you know the dose,
Right.
right? But you're just starting out, they're the worst place to start because you have zero control of the dose.
So we go back to health assessment protocols. So you run your red blood counts, you run your sex hormones, you run your thyroid hormones. You are more meticulous at rechecking that with females than you might not necessarily have to do it with males. Is there anything else you can check to kind of assess their compatibility to go that route? Maybe some fitness tests, maybe some kind of other interviews. Maybe you check, hey, where do you actually live, or what's happening with your
Yeah, yeah.
nutrition, those
So,
kind
so
of things.
yeah, yeah. So number one would be their sensitivity. So let's talk just sex hormones right now because that's a big topic, especially with females and males. Those are kind of the ones that they're most likely to get prescriptions for that neither they or the doctor have a good grasp on. Okay, so number one, fitness tests, right? Like how much cardiovascular work do you do and how much cardiovascular fitness do you possess? That will be reflected in what we just talked about with the hematocrit and the red blood cells.
So
But
let's say they don't do any kind of training physically. Would you
yeah,
check their resting heart rate or blood pressure? What
yes.
you want to see
Yeah,
something
yeah.
there?
So if they do not, so let's say their blood work looks good, right? Like you don't have really high hematocrit or high hemoglobin, then the next thing I say is, okay, do you currently do any cardiovascular work? If the answer is no, then immediately the next thing I want to know is, okay, what is your blood pressure? What is your heart rate, right? If your blood pressure and heart rate are not in the sweet spot of 120 over 80, right? For somebody who does no drugs, right? At this point, they're not taking any drugs and they're not doing any fitness training, right? Or at least cardiovascular work. If their blood pressure is in the sweet spot, that makes me feel much more confident that all they got to do is get some walking going on and the introduction of testosterone or sex hormones isn't really going to affect a lot of that. Now, if they don't do any of those things and their blood pressure comes back 130 over 85, it's a little bit on the higher end and they don't do any fitness training, then what I would like to see is the introduction of fitness training. About 5 weeks later, there is a downward pressure on blood pressure. If their reaction to a little bit of cardiovascular work is blood pressure comes a little bit lower, that tells me that their system is working very well. It tells me, okay, a little bit of an input, it gets handled, excellent. A little bit of testosterone or a little bit of sex hormones is not going to be that big of a deal for this person. But if they do cardiovascular work and nothing happens to their blood pressure, it tells me they're a poor responder to that stimulus. They're going to need more work. Now, I have to say this, not because it's a conspiracy, because it's the truth. I have noticed if you've been jabbed, your blood pressure will run higher than normal. I've seen that with multiple people. I've also seen some aberrant things with thyroid and with red blood cell counts. That tells me if you have had the COVID shots, specifically the mRNA ones, you may not be a candidate for testosterone replacement therapy. I've seen that. I've just seen it across the board. So I have to say it because at this point in time, we do have evidence that we were lied to, right? Like they were not
Yeah,
safe and
partly
effective.
it was just run through.
So this isn't conspiracy theory. This is the real truth. I have dealt with people that now have and verified, they've had the booster and all of that, and they didn't know, they were either employed by the government and they needed to take it to keep their job or whatever, and now they're living with the repercussion of, hey, they need to be on top of their mitochondrial health more than everybody else just to maintain good statistics on their blood work and their cardiovascular level. So that is why. And those people, right, if they were to ignore that and start taking testosterone replacement therapy, they would be at more risk, right? That their risk factors are going up. So it's one of those things where it's multifaceted now, especially with the introduction of the jabs.
Yeah,
And
so
that
far from what I see, they are more injury prone as well, which is you never know what might be. It might be that it just impairs their recovery to the point where they don't recover as well as everyone else.
that's what I suspect. That's what I suspect because the values that I see disrupted have to do with oxygenation in tissues and
Right.
have to do with and that would also imply nutrient delivery at all tissues, right? If you can't deliver oxygen, you're probably not delivering other nutrients as well.
Right.
So it's not surprising. I do see that, and they also tend to be a little bit more inflamed by just normal training. Normal training tends to inflame them. I tend to see that they can do more cardiovascular work as long as it's not high intensity, and that seems to help the markers. But weight training or inducing hypertrophy or strength training or anything like that, they tend to not be able to handle very much volume because they tend to not be able to recover from whatever that is. They just have residual inflammation, which coincidentally, what does that go back to? If you can't disperse inflammation, you now get inflammation in endothelial tissues. That's cardiovascular tissue. So that predisposes you again to the strokes, the heart attacks, that type of stuff, which is what we see in the data, right? And so that's a big one that I now actually, before I actually go on board with anything hormone replacement therapy wise, that's a question now that I ask people is, have you been vaccinated? Not because it automatically disqualifies them, but it makes me need and want to pay more attention to their fitness levels and those markers of hematocrit and all of that. Now, just having those markers elevated doesn't automatically disqualify you. And then that's where there's a little bit more in-depth questionnaire, right? Like, hey, do you have a history in your family of cardiovascular disease, cardiovascular events? If the answer is yes to any of those, plus you've had a jab, the thing that I want people to do is go to their doctor, get a calcium score test. That will, without a doubt, show you how much calcium plaque is built up in the arteries. If there is a significant amount, then at that point in time, I would tell you, you are better off not taking hormone replacement therapy because the risk is too high, right?
Mm.
You're better off on focusing on your fitness level, your lifestyle factors, and ensuring that those are immaculate as possible. And as those markers get better, you could take a calcium score test because you can reverse it, right? Like this is not a permanent thing. You can reverse it with good fitness and nutritional practices and lifestyle practices. So it's not like it's permanent, but it means that, hey, at this point in time, too much risk to go a step further. Let's concentrate on the fitness, the lifestyle, and the nutrition first before moving to something like hormone.
So for
And
someone like that, whom you would not kind of advise hormonal replacement therapy, how long would it take with lifestyle changes to see any kind of benefits, and how does it differ from male to female?
yeah. So in females, if you at the right time of year, I've seen it change pretty quick, right? So right time of year meaning starting the lifestyle changes and all of that type of stuff in the spring. I find that by the middle of summer, most of the things have been corrected for sure, especially from the sex hormone side, and the thyroid sign seems to correct even sooner than that
Mm.
somewhere probably a month or two before, but we just don't have that many blood works in between to tell exactly when it happens. But usually about 6 months is a good time frame. If you start in the spring, about the middle of summer, most of that has been corrected in females. In men, you start seeing changes no almost no matter what time of year, as long as I get them going outside, because even in the cold, men can make sex hormones through that action. I've seen this happen with older men. I've had experience with a guy in his 60s, went from a testosterone of the 200s up to 600s over the course of 1 year, only because that's when his blood work lined up. I suspect that it was already up at 600 at like the 8 month mark. So around 6 months to 9 months is expected with just lifestyle changes to see improvements. And sometimes the improvement is drastic. Going from 200 to 600 at 60 years old, that's a big difference. Like he literally reported, he's like, yeah, I have a good sex drive now. I don't really need replacement therapy. He's like, that's more than enough that I need. So at that point, he doesn't need any, right? Like he just took some supplements, a little bit of pregnenolone, a little bit of DHEA, got a lot of sunlight, got a lot of outside exposure. 9 months later, 10 months later, he's like, goes to his doctor, and his doctor is like, wow, and not only that, his blood pressure improved, was able to get off all of his statins and blood pressure medications, completely normal blood pressure, sex drive is good. He's like, I don't really need anything anymore. I don't really need any medications. I don't need to take any of them anymore. And that was it, right? Like, you can change it if your environment is conducive for the change, and you just got to get out and interact with it.
So going from all that, we kind of covered that fundamentals, gender-specific considerations, health assessment protocols, risks, benefits. What would you say would be the potential steps for people to take to self-educate themselves a little bit more? Because you need to understand what you're doing, or it's not going to work. Just taking medication on top of other medication is not going to lead anywhere. You need to understand that, okay, to get that vitamin D naturally, you need to go outside without a sunscreen, because I've seen predominantly women who live outside 24/7, and they have very low vitamin D levels. And lo and behold, they're always covered in sunscreens because they are paranoid about getting cancer and God knows what else. And obviously,
Yeah.
the hormone sex drive and many other things coming from there. So, is there anything that they could look up to, where people could reach out, or?
So I mean, for free immediately, and it'll take like 5 minutes. You go to DutchTest.com and you look at their sex hormone map, right? And you can clearly see everything starts with cholesterol. The only thing that they don't tell you is that the cholesterol has to be interacted with by sunlight. Now, you and I have done lots of videos on sex hormones and thyroid. Those would be the next step, right? Once you understand how the system works, having somebody explain it with words on exactly, hey, this molecule interacts with sunlight, it turns into this molecule. Once you kind of get that flow, it's very easy to understand. Oh, I just need to do a couple things, do them for long enough, and I will see if I can change this, right? It's really, the information is out there for free. You can literally go to your YouTube channel where we have all our videos. You could go to our school group and have all those videos, plus the Solar Athlete. They're like 12 modules that literally there's little science in those, and it literally walks you through exactly what to do day by day on, hey, do these at these certain times of the day, and you will definitely be able to start changing things. The information is out there. You just have to let go of what doctors have told you. You're not deficient in medications. You're deficient in something else. Sometimes your body is not able to make those things naturally. Then you need a medication.
Yeah, yeah, and we see it way too often that it's like, hey, you just need to take this, and based on that, and genetics test is showing you this and that, and you're like, yeah, you sound like marketing
You sound
expert.
like you want to sell me something.
Yeah, rather than you want to help me, and we know a lot of these areas are where people live very long life with very high quality as well. But I
Yeah.
think this is amazing video as usual. If there is nothing else you want to add on this topic, I think we can round it up and catch up in next video.
Awesome. Thank you.
Yeah, thank you.